There's no question that a pregnancy can take a toll on a woman's body, including her back. Dr. Sean Riley from Tulsa Spine and Rehab joins us. Dr. Riley, what advice do you have for pregnant women struggling with low back pain?
Yeah, Scott. Actually, I see a good handful of pregnant women, believe it or not. I think that surprises a lot of folks when I tell them that's something that we see. It's typically a lot of the athletic, active type women in the practice, and then they go through a pregnancy, and then they come in, and their first question is this safe for me? Or is this something that you could potentially help me with? And the first thing that I would like to address is the safety of it. Barring obviously you want to check with your OB. Make sure there's no contraindications or problems potentially with some type of chiropractic or osteopathic manipulation or recommendations. And then once the green light from there, you can start treatment. I've never had an issue with a pregnant woman. I've got, I want to think that we've done relatively well with a lot of the patients that we've treated. And one of the things that I talk to a lot of these women initially is that we're just going to work on managing your symptoms. It's nothing that we're necessarily going to fix. The most common complaint is going to be low back, obviously, some type of lumbopelvic dysfunction or pain. And when I talk about lumbopelvic, I'm going to talk about the low back region or that pelvic region. That's typically where females are going to experience some type of discomfort. They might even complain of sciatica or sciatic type symptoms. We've discussed that in the past, where that sciatic nerve gets irritated and you have some pain going down the back of your leg. So, like any patient, I'm going to take an assessment or a history to determine, what their issue is. One of the biggest problems with a lot of pregnant females is that they produce this hormone called relaxin. And relaxin, it does just what the name implies or how it sounds. It, starts to relax the joints and so forth, lets that pelvis open up so they are able to deliver a child. But subsequently, what happens is it starts to relax all the ligaments as well. And when you start to relax all those ligaments, you create potentially some instability. So areas that we were stable aren't so stable now. We start to have increased pressure, irritation put on different types of joints and so forth. And that's, why it's so important that when you're assessed, we make determinations where they might have limitations, not only with mobility, but, where can we improve some stability? 3 tips that I give all pregnant women is, number one, and most importantly, is exercise. It's very safe for pregnant women to exercise per their OB. Now, I'm talking about just your general run-of-the-mill pregnancy, Scott. It's very important that a woman maintains a level of exercise and activity throughout her pregnancy. It will not only make them feel energized, but it also will, keep those joints mobile, keep everything moving, keep you active. I recommend that you start stretching, just warming up gently. Walking is a really good activity. And then depending on your exercise level prior to your pregnancy, a lot of women stay very active throughout their pregnancy. I mean, they might participate in a bar class or continue with a personal trainer, different types of, functional, exercises. But I think it's very important that you consult your OB to determine what you're able to do. So exercise is number one, very, very important. And secondly, posture is going to be very important. So once everything starts to relax and loosen up, biomechanically, we might have some changes. Like when we go to bend or to lift, we might start flexing or bending too much in our back. Where we should really focus on is bending more in our knees and our hips, more of a proper hinging pattern. So I talk to a lot of patients about, make sure that you have or focus on your biomechanics, make sure you're moving properly. Try to avoid putting increased stress and pressure on the low back and maybe the sacroiliac joints, some of those joints in the low back. And then lastly, I encourage all the pregnant women to eat healthy. They're going to need more nutrients as they're pregnant, and I think it's very important that they consume a healthy diet. So exercise, posture, and eating healthy are 3 of the main 3 tips that I'm going to recommend to a lot of those patients. And then lastly, related to treatment, what is it that am I going to focus on with these patients? So manipulation, we've spoken about that. That's one of my tools in my toolbox. We're going to find out if there's an area of dysfunction or if it's not moving as well or an area that's irritated. See if I can get that area moving a little bit better. And then more importantly, potentially making some recommendations to simple stretching or stability exercises that they can manage these things on their own throughout the pregnancy.
The team at Tulsa Spine and Rehab specializes in low back pain no matter what the cause. Give them a call today to see how they can help you. 918-743-3737.